First, in managed isolation, we have one new case to report. This is a woman in her 30s who arrived in New Zealand from the Philippines on the 8th of August. She has been in managed isolation at the Distinction Hotel in Hamilton and tested positive at around day 3 of her stay. Moving now to the community. There are 13 new confirmed cases of COVID-19 to report in the community. They are all in Auckland, and they are all linked to the 4 people who we reported as confirmed cases yesterday and the day before. We will put the details of these cases up on our website, as we have in the past. That means we now have a total of 14 new confirmed cases to report today, the 13 in the community associated with the other community cases already, and the one new one from managed isolation. And that brings our total number of active cases in New Zealand to 36. 17 of these are linked to the recent or the new outbreak. Given that all these cases are linked, we are treating them as a cluster, and what we know about clusters, as we've found out in the past, is that they do continue to grow. So we fully expect there will be further cases. There are some symptomatic people. Of course, they have been tested. They are in isolation and all appropriate steps being taken. We will update you if results come through that confirm those cases on a daily basis. So just a little more detail around the new cases. One that I think we've already all know about is a student at Mount Albert Grammar School. This is a relative of the previously announced cases in the community. The school has sent a letter to a number of students and a handful of staff who, after inquiry, were considered as close contacts, advising them to self-isolate for 14 days. All those people have already been spoken with by our National Contact Tracing Service this morning. The student was not symptomatic while at school and has not been at school since they became unwell and got tested. So the chance of exposure of anyone in the school community to the infection is considered low at this point, but of course we are taking all precautions, and everyone in the whole school community has been asked to monitor their health closely, seek advice from their GP or health line if they have symptoms of COVID-19, which could include a new or worsening cough, a sore throat, runny nose, fever, temporary loss of smell, and difficulty breathing. Moving on, 3 of the people who have tested positive are employees of Americold, the workplace where one of the previously reported cases was, worked. Another 7 cases are family members of these employees. 2 Americold sites in Mount Wellington and at Auckland Airport have been closed. The Mount Wellington one, where the the second case worked at, has been closed since Tuesday evening, and the airport site since yesterday. A mobile testing unit went to the airport site, and all the staff who work there have now been tested, and a mobile testing unit went to the homes of symptomatic people from the Mount Wellington site yesterday, and they've all been tested. And further testing is underway of other employees who work on different shifts at that Mount Wellington site. Moving on then, another person who has tested positive is an employee of Finance Now. This is the workplace of the very first case that we reported. That person actually was admitted to North Shore Hospital overnight, has now been discharged. And there is another person who has tested positive who is a family member of that Finance Now employee. We also have still one probable case of COVID-19 in the community, and that is also linked to the new outbreak. As part of our overall national response to this new outbreak, I am now directing medical officers of health that all cases, confirmed cases, are to be managed in a quarantine facility. Now, this is different to how positive cases were managed when we were last at levels 4 and indeed 3, and shows how serious we are about limiting any risk of ongoing transmission, even in self-isolation and including to others in the household. This will apply to any cases and also close family members who might be at risk as appropriate. On to testing. I'll update you now on the testing numbers. Yesterday our laboratories processed 6,006 tests, and the total number of tests now processed is 508,711. I should say that the total number of swabs collected yesterday was well over 10,000. The cut-off time for reporting is midnight. Many thousand have subsequently been reported, and labs are processing those as rapidly as possible. Demand has been high, as you will all know, at our dedicated centres for testing across Auckland, and I want to thank people for being so patient as they waited yesterday and for showing up. It's important to know that while we have an increasing number of pop-up testing sites around Auckland, anybody can also be tested at their GP, and this is also free. And this is the same around the whole country. There will be a further 2 pop-up testing sites open today in Henderson and at Airport Oaks, so the total number of pop-up and permanent community testing centres will now be 15 across Auckland. The Vaughan Road Centre in Rotorua and the Miro Street Centre in Taupo have extended their hours. They are now open 9 till 4 p.m, 7 days a week. And likewise, Lakes DHB is setting up a testing centre in Turangi opposite the police station today and Friday, and a further Rotorua testing centre at Devon Street West's International Stadium will be open today and through the weekend. We are also aware that one of the people who has tested positive has visited an aged residential care facility in the Waikato. I'm not going to name that facility today because some of the residents and their families are still being informed. However, the Public Health Unit and Ministry staff and the facility were planning last night about what they needed to do in response. All aged residential care facilities in the country are currently closed to the public. They're closed to visitors, but anyone who has visited this facility recently will be notified by it and should also closely monitor their health and seek advice if they have concerns. As soon as the residents and families have been notified, we will let you know the name of that facility. I must say that the visit was when the person was not displaying any symptoms, but they did develop symptoms the next day. The visit was to a family member resident, and the visitor saw their family member and had some contact with several staff. I know at least one person who has been tested already has returned a negative test there. And today the DHB will be arranging testing for all staff and residents in the unit where this visit took place. And of course the DHB is working closely with the facility to ensure they have all the personal protective equipment that they need. I want to thank the facility for being both helpful and extremely professional in their response. Now to a further update on Rotorua. I'm going to provide you with what we know about the movements of the family that made the visit to Rotorua. Testing is available to staff of any business or people who visited any of those businesses at or directly after the times I'm about to read out. So from what we know so far, the family checked into the Waiora Lakeside Hotel at 3:30 p.m. on the 8th of August. We also know they visited the Herbs and Spice Thai restaurant at 8 p.m. that evening on the 8th. The following day, at around 2:30 p.m, they visited the Pack and Save supermarket at Amaho Street in Rotorua before heading to the Heritage Farm and 3D Art Gallery at 3:30 that same day. So that's the 9th of August we're talking about. And at 4 p.m, they then headed to the Skyline Gondola and Luge. Now the following morning, and this is important, on the 10th, that is Monday, they visited Sail Barbary Echo Sailing in Taupo. So they made a day trip down to Taupo at 10:30, and I understand they took a boat trip, and all the people who were on that trip with them have been identified and contacted and been followed up as close contacts. Then the family returned to the Heritage Farm and 3D Art Gallery. This is back in Rotorua on the 10th at 3 o'clock. That evening, they visited at around 7 o'clock the Burger Fuel Redwood Centre in Rotorua, and on their way home, they had a brief stop in Hamilton at 9 a.m. for fuel on the Tuesday morning. There's no sense of any contact with anyone there. I don't have the name of the petrol station that they stayed at, but the inference there is that there was no contact with people. Now, for those businesses visited by the family who haven't been issued yet with an alert through our app, the advice is the same. Monitor your health, and if you're unwell, ring Healthline. Testing is available to any business that requires it or would like it, if the employees there, and of course anyone who is symptomatic should take immediate action. Again, reflecting on this, the work that the Public Health Unit has done with this family, Aside from the sailing trip, which there were some others on, the sense is that at most there is casual contact with other people at those other places. We know there are other locations they also visited, but it's important to note at these locations we're confident there is no risk of exposure to anyone. For example, the family members were the only ones at those locations at the time, or they would drive through. I'm nearly there. The app alert. So this morning for the first time we have utilised the alert function on the NZ COVID Tracer app, which allows us to send a notification to anyone who has scanned into locations at the same time that we know people who have tested positive for COVID-19 were there. We have issued an exposure alert covering the 2 separate visits of the family in Rotorua to the Heritage Farm and also the 1 visit to the Skyline Gondola. So that alert has gone out to anybody who has the app and had used it to scan in at the times that family was at those facilities.
As you can see from the latest update this morning, you can see the seriousness of the situation. While it is serious, it is being dealt with in an urgent but calm and methodical way. As we all learnt from our first experience with COVID, once you identify a cluster, it grows before it slows. We should expect that to be the case here. The fact that we are in level 3 in Auckland is giving us a helping hand. It means that when we are contacting people, they of course are already observing restrictions that limit the spread of the virus. You will have heard from the update that there is more information we need to find, such as the source, or what we generally refer to in a cluster as the index case. We've managed to contain clusters before without identifying the source, but knowing where it has started does give us that extra confidence that we have reached everyone we need to in order to stop transmission. So here is what we ask you to do on an ongoing basis and until, of course, the updates that we continue to share. If you live in Auckland, work from home if you can. If you go out, of course, it's for essential items, food, exercise, getting a test if you're unwell. Whenever you leave your home, we encourage you to wear a face covering, and it's great to see so many people are observing that advice. There are now 15 special purpose COVID clinics, and I do want to again re-emphasise what Dr. Bloomfield has said. We have seen congestion at those clinics, and I acknowledge people are trying to do the right thing but are getting frustrated by the waits. You can go to your local GP. We do ask if you're symptomatic to call ahead so they can prepare for you, but you can be tested there for free as well. If you are well, though, if you are in good health and you have not been asked for any reason to get a test, we ask that you just stay put. It helps us to prioritise the testing. For businesses at level 3 in Auckland, you'll recall that customers cannot be on your premises except for those key exceptions: supermarkets, dairies, petrol stations, pharmacies or permitted health services. But for everyone else, of course, we encourage you to use contactless pickup, click and collect or delivery services. We saw under level 3 last time that businesses did a great job of adapting to still provide to their customers, and it should be no different this time. For those businesses where people cannot work from home and you are not customer facing, a reminder just to comply with all of those measures that we've put in place so you can operate safely, including social distancing. Now, I know this disruption to businesses is putting extraordinary pressure on you, but the best long-term economic response is for us to get this immediate response right. For businesses across the country, a reminder that all must put up in place a QR code for use with the New Zealand COVID Tracer app at each entryway so people can track their movements. You must put up your poster before the 19th of August to avoid penalties. Many of you have, and I really thank you for doing that. An update on checkpoints. There are 10 checkpoints operating. Police have provided maps and details of the locations on their website and social media pages. I'm told by 7 a.m. roughly 17,000 vehicles had been stopped. Mostly those vehicles were travelling for the right reasons. 312 by 7 a.m. had been turned back. Police are reporting that there have been attempts made by people to travel to their holiday homes. Again, I just reinforce, if your residence is in Auckland, we are asking you to stay put. Finally, I acknowledge the anxiety of some New Zealanders as we are moving at pace to stamp out COVID in our community and protect the health of all New Zealanders. But the pace and the speed should also act as an extra layer of reassurance. Within 6 hours of this case and notification amongst health officials, we were informing people of the need to move alert levels, and in less than 24 hours, Auckland was at level 3. In Hong Kong, Vietnam and Victoria, which are all managing the re-emergence of COVID, they in some cases waited 3 to 4 weeks before implementing restrictions similar to ours. Going hard and early is still the best course of action, and we all have a part to play in that. I'll say again that as with our first outbreak, we do have an expectation that things will get worse before they get better, and we'll all remember that pattern as well. And modelling suggests that we will still see more positive cases. Again, though, at this stage, heartening to see them in one cluster, which I think is a take-home from this morning. But once again, we are reminded of how tricky this virus is and how easily it can spread. But we know that limiting people-to-people contact really helps stop the spread. We have a plan, we have acted quickly, and now we'll continue to roll out that plan. If you have any questions that have not been answered here today, please visit the Covid-19 website. Healthline staff have been increased by an extra 180 people, but they are there to help with immediate needs and health needs in particular. As for future updates, there will be a 1 p.m. briefing again tomorrow. We will then do an extra briefing later in the afternoon after Cabinet has convened to share next steps. We'll confirm the timing of that extra briefing later on today. Till then, everyone, look after yourselves. Remember, be calm, be kind, and continue to stay strong.